Hello, I'm Brigade. I'm Staff Sergeant Knuckles, and this is Specialist Ruiz. We're members of Bravo Company, War Machine, 1st Battalion, 8th Infantry Regiment, Fighting Eagles. Today we will be given a block of instruction on the EIB Task M9, treating an open abdominal wound and eye injury. Task: perform first aid for an abdominal and eye injury. Condition: you are a member of a team on a mounted combat patrol. You witness an improvised explosive device immobilize the convoy's lead vehicle. You are assisting medics with triage and treatment. You are behind cover, not under hostile fire, and your teammates have established a security perimeter. The medic performed a rapid trauma assessment on the first patient and determined that there are no other immediate life-threatening injuries. The medic directed you to treat the open abdominal wound and eye injury. You have a combat lifesaver bag, are not in a seaborne environment, and the casualty is conscious. Standard: perform all tasks as standard, in sequence, within 7 minutes, without causing further injury. Training aids provided to the candidate: a simulated casualty, either an actual soldier or mannequin with all extremities, with a clearly visible simulated abdominal wound with simulated organs or intestines outside the body, and an eye injury. Casualty will be in full combat uniform per unit SOP, including weapon and a fully packed improvised first aid kit. Casualty should be positioned on the ground where the candidate will apply aid. A CLS bag including all appropriate bandages, dressings, and materials needed to improvise. Step 1. Check for both entry and exit wounds. There should only be one, by sitting casualty up or rolling to the side. Position casualty on back, flex knees, and turn head to side, keeping airway clear in case of vomiting. Step 3, expose the wound. Pick up organs that are on the ground using a clean, dry dressing and gently placed on abdomen without touching them. Do not probe, clean, try to remove foreign objects from or push organs back inside the body. Step 4, apply a moist, sterile abdominal dressing. If an object is extending from the wound, do not remove it. Place as much of wrapper over wound as possible without dislodging or moving. Do not place wrapper over object. Ensure dressing is large enough to cover entire mass of protruding organs or area of the wound. If large enough to cover affected area, place sterile side of plastic wrapper directly over wound. Place dressing directly on wound or plastic wrapper if used. Do not apply pressure or expose internal parts. Tie dressing tails loosely at casualty side or secure hooking ends of closure bar into bandage. Repeat if 2 dressings are needed. Ensure that the ties of additional dressings are not tied over each other. Ensure dressing is secured firmly enough to prevent slipping without applying pressure. Step 5, treat for shock. Loosen binding clothing, prevent the casualty from getting chilled or overheated. While performing this, stay at the gradable state. The casualty is making vomiting sounds. Roll to side without causing further injuries. Gradable state, vomiting has stopped. Return to supine position with knees flexed, resecure bandages, and blanket if needed. The grader will decide which injury will be evaluated during testing. For the purpose of this video, we will demonstrate the 4 injuries that you may encounter. Step 6, treat lacerations and contusions of tissue surrounding the eye. Close the lid of the affected eye. Do not exert pressure or manipulate the globe in any way. Cover the injury with moist, sterile dressing to prevent drying. Cover torn eyelids with a loose dressing. Place field dressing over iPad or dressing. Step 7, treat injury to the eyeball. Do not reposition the globe or replace it in its socket. Hang on. Sorry. We just did 6, right? All right, my bad. I wrote the wrong one. Step 7, treat injury to eyeball. Do not reposition the globe or replace it in its socket. Cover injured eye with a sterile dressing soaked in saline to keep the wound from drying. Place a field dressing over iPad. Tell casualty not to squeeze the eyelids together. Step 8, treat extrusion. Cut a hole in several layers of dressing material and then moisten it with saline. Place dressing so globe protrudes through hole without touching it. Build up dressing higher than globe. Apply Fox eye shield or improvised object such as a paper cup, structural aluminum malleable or SAM splint, or intact set of eyewear secured in place. Apply garter shield cover or tape to edges of Fox eye shield or object. Place over the injured eye, resting on the bony support of the face and secure with tape. Step 9, treat protruding object. Mobilize object and dress with moist, loose dressing. This completes the task for Mike 9, treating an open abdominal wound and eye injury. Check on learning. Question 1. Position casually on back, flex knees, and turn head to side, keeping airway clear in case of what? Question 2. In step 3, pick up organs that are on the ground using what? Question 3. Treating injury to the eyeball, cover injured eye with sterile dressing soaked in what? Question 4. Treating extrusion, build up dressing so that it's blank, then the globe. Question 5. Treat protruding object, immobilized object, and dress with what kind of dressing?